We're back, dear viewers. So today we are honored to host Dr. Sultan Alqadiri, a senior specialist in internal and geriatric medicine. This field, dear viewers, is one of the rare but very important medical specialties here in Kuwait, as it focuses on the comprehensive care of older adults and addresses the unique health challenges that come with aging. With Kuwait's population living longer and healthier lives, geriatric medicine has become increasingly vital. Dr. Alqadiri's expertise here bridges internal medicine with elderly care, ensuring our senior citizens receive holistic medical attention, prevention strategies, and support that enhances their quality of life. So, dear viewers, let's all welcome Dr. Sultan Alqadiri, an internal and geriatric medicine senior specialist. Good morning, doctor. It's such a pleasure to have you.
Good morning. Thank you for inviting me over and hosting me in your show.
You're most welcome, doctor. So please, doctor, would you explain all about geriatrics and what does it mean for our dear viewers?
That's an interesting question. Since I've come into practice, let's say my definition of geriatric medicine continues to change and evolve. The latest one that I'm most comfortable with is geriatric medicine simply is a branch of medicine where we focus on the elders' level of independence, are any barriers in their ability to do things for themselves, and how we can improve that and improve their quality of life.
All right.
Yeah, whereas most specialties in medicine focus on a disease or focus on a symptom, we, as you mentioned in the intro, we take a more holistic view on the elderly. We try to see what their level of functions are, whether it's physically, whether it's environmentally, whether it's mentally, and try to address those things and have a tailor-made plan to address those issues.
That's very nice to hear that, doctor, you are caring for our beautiful elders. And when you say elders, doctor, from which age segments are they?
Well, to make it simple here, especially for databases and statistics, we tend to target those above the age of 65. But as I'm sure you're aware, not everybody above the age of 65 is the same. So some people who are younger than 65 need more help than others. And some people, mashallah, they're pushing on 90s, early 100s, and they are doing really well. So it's a bit of a gray zone, but to keep it simple, 65 and above is our main target.
All right, dear viewers, if you are from the elders, we love you so much for tuning in also here on Good Morning Kuwait's program, and especially with our doctor here. So doctor, also, why do you see this specialty a rare thing here in Kuwait, and how do you see its future in the state of Kuwait?
Well, the reason for it being rare, it's a relatively new concept in Kuwait. Culturally, we tend to, once somebody gets a bit older in age, they take more of a, let's say, of a backseat in terms of prioritizing health outcomes. And that's changing now. We are, as you are noticing globally, more and more elders are taking more prominent roles in politics and decision making. Yes. So they have a louder voice now more than ever. They have a bigger role to fill, and we need to enhance that and encourage that. So that shift is changing, and our specialty is not as flashy as some others. So we know that there's robotic surgeries, microsurgeries, grafts, things that are really exciting and future thinking, whereas for us it's more about communicating, connecting the dots, seeing ways to let's say little subtle ways to improve things, and believe it or not, it's very, very let's say reassuring. It's very, very self-enhancing and motivating, and it really is we're making dramatic strides in overall healthcare in our elders.
All right, and doctor, as you know, as you said, elderly are from the 65 and above.
Yeah.
How many times do you recommend they come and visit your place to do medical checkups? Do they come weekly or monthly, or what is it?
I'm really happy to ask that question. I mean, the general person I like to refer to elderly and to see are once before they get sick. So having routine follow-ups, having scheduled visits, I think is very essential, whether it's in my service, in the secondary hospital, or even in primary care. So seeing somebody, as we all know, prevention is better than treatment. So seeing what are, let's say, little things or red flags before they happen, we tend to tackle them and address them way before the person gets sick. It's much easier to manage and also has better health outcomes.
Yes, doctor, you know, sometimes when I see elderly people walking on the beach and, you know, they have, mashallah, all this white hair, I sometimes say, I wish I could just age like them and
Yes.
do these healthy things, habits they have. And as you said, it is important for early medical checkups and things like that.
Exactly.
And sorry, doctor, but how do you see the challenges facing the elderly, you know, like most common health issues that are happening?
Well, there's multiple challenges. The main one, it's trying to separate what is actually an illness or chronic condition and what is part of normal aging. And so that's challenge number one. And a lot of times things get blurry. We're not sure if the person is actually getting sick or it's just a natural progression of things that is expected to happen as we age. And we need to do a better job in educating the public, the elders, and also physicians on how to pick up on those changes. Another big challenge, especially in our culture, we love our elders, like you mentioned a few times.
Yes.
And as part of showing our love to our elders, we like to make them comfortable. So we do things for them. That's not always a good thing. Sometimes by making somebody too comfortable, they don't adapt to the changes that happen, whether it's to their body or to their environment around them. And by taking away that, let's say, that little discomfort, they tend to rely more and more on others to care for them.
Okay.
And then with that, it makes it challenging for us, especially as physicians, to know, okay, so let's say the elder that you loved is no longer walking because, you know, for comfort reasons, we got them a wheelchair.
Yeah.
Are they using the wheelchair just for comfort reasons, or are they actually not able to walk? Or is there something serious happening that we didn't really pick up on because they're not walking so much? So then we have to think retrospectively, and try to treat those issues. Whereas if we picked it up from the earlier signs, the person is not walking, the person is having difficulty walking, let's treat that now and observe. That would be the better way to go around things.
Yes, as you know, doctor, as you mentioned, you know, some people who are in their 40s, they think they're old and they try to act like they're old. But as they say, how you treat yourself is how you get life coming to you as well.
Of course, of course.
Therefore, doctor, you know, like some chronic conditions happen here in Kuwait, mostly diabetes that come from fast food and all kinds of machbusas that are happening.
Yeah.
What special treatment do you guys provide or management for these people?
Well, I think if you were to ask me what's the best thing we can do is start early. So right now, when you're in your 30s, 40s, 50s, once you have diabetes, once you have trouble with obesity, try to tackle it hard now. Try to get that under control now, because once you get a bit older, things get a little trickier. The studies done on medications and surgeries done for, let's say, obesity and some of the medications for diabetes, they aren't really studied exclusively for the elders. They're mostly for the younger population. Okay. And by the time somebody gets old, in my practice here, we want our elders to eat. We want them to be happy. So trying to restrict them from things they enjoy once they're 70, 80 is a lot harder to do than when somebody's younger. So address those issues first when you are younger. Once you get older, I think it's important to know, number one, it's what's their level of independence. So to know how hard should we target, how should we target those issues. And number two, we need to think realistically about what can be done and what needs, let's say, we don't hit as hard, but try to make it to a way where the elder can tolerate it and not do more harm than good.
Yes, doctor, you mentioned so many physical parts that the elders should do. Yeah. But would you also mention some comprehensive part that affects their cognitive skills and maybe, you know, memory loss a little bit? How can we help them benefit more?
Thank you for asking that question. About a year ago, there's a big publication happening in the Lancet that tries to address, let's say, they say 45% of like memory loss can be, let's say, modifiable or can be controlled. And a big bulk of that is things we do once we are younger. So stopping smoking, getting a better diet, avoiding having a sedentary life. So go out, move more, don't stay at home. Cardiovascular exercises that helps with the blood flow, that helps prevent memory issues. Controlling the diabetes, controlling the hypertension, avoiding social isolation. Alhamdulillah, our culture in Kuwait, there's a lot of family visits, a lot of visitations, and having family around is a big part of our culture. So that's actually a protective thing, and we want to encourage that even when you get older. Yes. Even if they don't want to, bring them out to family functions, your elders. Have them it's called take part in family services. At the same time, also addressing vision, addressing hearing at an early stage can also have protective factors once you get older.
Yes, doctor, for sure. We love, definitely, dear viewers, we love our elders because they are telling us the stories of the past here in Kuwait, and
of course,
we need to maintain their memory as much as we can so they can also tell their grandchildren.
Yeah.
And therefore, doctor, like, you know, when it comes to medicine, there is something about geriatrics and vaccination and nutrition.
Mm-hmm.
Would you give us more examples, please?
So in terms of, thank you for bringing that up. I think I mentioned it earlier, preventative strategies is a lot better than treatment. So winter's coming. I think earlier today you said the weather is hopefully will start to get more beautiful soon. So we want our elders to enjoy this beautiful weather. We don't want them to be in hospital. So getting your routine annual vaccines, if you haven't done the pneumococcal vaccine, getting that addressed so that you don't get chest infections and spend the entire winter. Our winter is what, 2 months? So you don't want to spend those 2 months in a hospital.
Yes.
Other vaccinations such as the shingles vaccine, and other ones are important. Routine screening for chronic issues like osteoporosis, colon cancer, chest scans, abdominal ultrasounds, all of these breast mammograms, these are all part of normal
checks.
Surveillance checks that should be done before something serious happens. So trying to get those when somebody is healthy. So if there is something wrong, we pick it up early and treat it early. It's a lot better than treating the consequences of it.
Yes.
In terms of nutrition, so mashallah, there's a variety of food available in Kuwait. Our traditional Kuwaiti food is very healthy, very nutrient rich. So to go back into natural foods, avoiding processed foods, limit carbohydrates, to increase protein intake, increase muscle growth foods and exercises will pay great dividends down the line.
It does really, dear viewers, create a lot of beneficial parts if you increase protein, as Dr. Sultan is raising your awareness, dear viewers, to have a healthier life and a lovely life.
Yeah.
Also, doctor, how would you recommend, like, for the elderly to maintain a healthy sport or a healthy diet? Mm-hmm. What kind of sports would you recommend for them?
Well, again, it's a really nice question. I think let's say our practices with the elderly has changed significantly over the years. So before we used to tell the elderly, okay, just do routine walking, eat healthy food, and that's it. But no, that's changing now. We want them to be very viable. We want them to be strong. We want them to be able to play with their grandchildren. So doing strength exercises, resistance training, so using weights, hitting the gyms and doing, you know, like the barbells. So that's actually encouraged. You want to increase your muscle mass. Other than that, also to help with the brain and blood circulation, mixing it, get in with a little bit of cardiovascular exercises such as walking, jogging, cycling. Walking
on the beach, doctor, I think that's so beneficial.
That's amazing.
Take some vitamin D too.
Of course, that's amazing on so many levels. And also, it shouldn't be abnormal now to see elderly or those a bit advanced in age to join a gym and have a structural plan with somebody who's trained in doing those exercises, because we don't want them to injure themselves either.
All right, so doctor, moving to our next question, how do you see Kuwait preparing for the future in elderly care? Like, would you see people flocking in, you know, from other countries to seek healthcare here in Kuwait?
I think we're in a really great position in terms of elderly care, especially in Kuwait. Now, over the last few years, and coming in with the 2035 vision on caring for the elderly, many establishments have been put in place, and there's a plan moving forward. So, apart from general awareness, like inviting me over to the show, other things that are happening is training people in primary care, training family physicians on what things to pick up on with the elderly, what things to address before they get sick in the community is important. So we are in the process of training our colleagues in primary care with that. Establishing a structured program to teach people so we can have more geriatricians in Kuwait. Right now in Kuwait we're a handful, treating roughly 150,000 elderly, so we need to increase that so we can increase their services provided. Other things that are being done is there's a lot from our welfare department and our social department that they are trying to promote elderly, make them visible in our day-to-day, whether it's in TV shows, in movies, in let's say in our
programs.
adverts and sports programs. As you mentioned, they have a wealth of knowledge. So we really, and you can only go as far as what you've learned from before. So their information and their knowledge is invaluable.
Yes, beautiful awareness messages from you, Doctor, to be honest, for our dear viewers. And we'd love to hear a last message from you to our people watching here.
Okay. So last messages, I think, so number one, I think as I alluded to, is give our beloved elderly a role in your life. So let them have a purpose. So if they before enjoyed to cook, let them, and now they no longer cook, let them be involved in the meal process, whether it's actively cooking or supervision. If they love to go out to the garages and fix up cars, let them come with you when you go to the garage. I mean, imagine if you have somebody elderly looking after or looking at the mechanic, making sure that they're not doing any funny business in fixing the car, they're going to do an extra, they're going to take extra care of your car. Apart from giving them a role, value their independence. Let them do things on their own. If you are feeling that maybe they need more supervision, supervise them rather than taking over that role. And number three, be proactive in healthcare. The thing I love the most when I see my patients coming in is them having a folder of their medications, their health issues, because sadly our healthcare system, there's a bit of, let's say, miscommunication and disjointment. Some people follow different hospitals, whether private and public. Some people follow primary care. So if you get a patient coming in or the care provider having everything summarized for you, bringing in everything together, it makes our job as physicians easier. Yes. And also asking the patient to do routine vaccinations, routine screening before they get sick. So be more proactive in your healthcare rather than retroactive is important. Yes. And finally, support the care provider. They are under a lot of stress. Looking after the elderly is not an easy job. A lot of times we tend to treat and help provide comfort for the care provider, even more so than the patient. So please keep an eye out and try to support the care provider as much as possible.
Thank you so much, Doctor, for being here with us on Good Morning Kuwait and enlightening us about these special topics that you highlighted.
Thank you once again for having me. It's a privilege.
You're most welcome. And dear viewers, if you have an elderly at home, please greet him every day because it's definitely worth it, and kiss them on the forehead for sure. So dear viewers, we'd like to thank our guest today, Dr. Sultan Alqadiri, an internal and geriatric medicine senior specialist. Thank you so much.
Thank you. Thank you for having me.
Dear viewers, therefore, our Good Morning team also was present at Al Sabah Hospital during the World Patient Safety Day 2025 event. Let's listen to what the medical staff had to say about this important occasion. Stay around.